Hi, everyone. My name's Alyssa. If you don't already know me, I'm the Health and Safety Supervisor for the Head Start program. I'm sorry I can't be with you in person today, but I hope that this training will be helpful for you with the new school year. So we are going to go over our health requirements for family engagement workers. So these are the topics we're going to talk about today. We have our health requirements, the various health forms and screenings, our individual health plans or IHPs, Child Plus data entry, and some processes and procedures. So our health requirements are based off of calendar days of when a child is enrolled. So within 45 calendar days from the start of enrollment, all children must be up to date on vision and hearing screenings. Within 90 calendar days from the start of enrollment, children must be up to date on their immunizations and physical exams, unless there are 3 reasons we might exempt them from this. We either have an exemption form on file, either for a medical, religious, or a strong moral belief for an immunization exemption. We have a documented catch-up schedule from the doctor, or the parent confirms that there's an upcoming doctor's appointment. We need to know the exact date of this appointment or any appointments for immunizations, because either myself or the FEW will follow up with the parent after the appointments to get those new records and update the child's immunizations in Child Plus. So it's really, really important that you communicate with me about the child's immunization status, because children who don't receive their immunizations within that 90-day period will not be able to come to school until they do so. So there is 2 exceptions to this rule. Hepatitis A is a strongly recommended immunization, but it's not required. And also influenza, a flu shot, is also not required. But if you see both of these immunizations on a child's immunization record, still enter them in Child Plus in the appropriate sections. So this is what it looks like in Child Plus, the immunization section. You need to remember a couple things. First of all, immunizations need to be entered in chronological order. Sometimes immunization records will put the dates in reverse order. So they won't start with the earlier date, they'll start with the more recent date. And if you enter it the way you're reading it that way, the immunizations will be entered incorrectly in Child Plus, and then I have to go through and delete all of them and re-enter them the correct way. So make sure you're entering them in chronological order. So it's especially important to look at the dates of the years they were given. So like for hepatitis B here, you can see the first one was in 2016 and then the second and third are in 2017. So just make sure you're verifying that those dates are in chronological order. Also, you can add a note for any additional vaccines that are received in the notes section of Child Plus in the immunization status section. This normally, like for Hib, most kids will receive 4 doses, but only 3 are required. So that 4th dose, right in the notes section, Hib, and the date, just so we have it documented. And I also just want to give a reminder, it is not your responsibility to enter exemption reasons. So these boxes on the right-hand side that say exempt, next to that in Child Plus, there is a drop-down box where you choose why they are exempt from this immunization. That is not your responsibility to enter. That is my responsibility. It also is not your responsibility to choose the PIR status if the child is up to date on their immunizations or if they've completed all of them for age. That's also my responsibility. I normally do that when I go through the ERSI list, but all children that is my responsibility. I will enter those. I also checked the CDC guidelines and entered this information. So if you see a child is missing a vaccine, for example, like PNU, pneumococcal, if they don't have their 4th dose and there's a red X on the right hand side saying that they are overdue for that dose, please let me know. I'll check the CDC guidelines. It's possible they might not need that 4th dose depending on the age they were when they received the 3rd dose. But that is also my responsibility to enter that information. So some common vaccine names, because they can get very, very confusing. They confuse me too, so don't stress about it. A lot of times we'll see combination vaccines noted on an immunization record. So a couple of those are MMRV or ProQuad. That's MMR and varicella all combined into one. There's Pediarix, there's Kinrix, there's Quadracell, there's Pentacell. So if you see any of these names listed on a vaccine record, make sure you're entering a date for each vaccine included. And like I said, I don't remember all of them either, but a quick Google search will help you identify which vaccines are in the combination dose. For example, I'm pretty sure Pediarix is DTaP, IPV, and Hep B all together. So on an immunization record, they might not list out those 3 vaccines. They'll just write Pediarix and put the dates. But you need to know that those are 3 different vaccines that all in Child Plus need to have those 3 dates entered for those 3 vaccines. It's also possible that children who were born in countries outside of the US have vaccines listed on their records that aren't given in the US. One of those I've seen is BCG. More recently, I've been seeing OPV, which is oral polio virus, which does not qualify in the US as IPV if it's been given to the child after April of 2016. So in cases like these, we cannot enter OPV doses in the IPV boxes in Child Plus because they don't count. So if you see things like that, just let me know. It's possible the child will need to have an appointment to receive IPV in order to be considered up to date. So let's talk about our health forms. There are many of them, but they're not very complicated. So first of all, our dental records. This is what our dental form looks like. You want to make sure you're entering the date of the most recent exam in Child Plus. You don't want to enter the date that the form was signed or the date that of the next appointment. So on the form here, the top right corner says date of most recent exam, March 27th, 2019. When you are entering the event in Child Plus, that will be the event date. On the bottom right side, there's a box that says date of next exam. That's September 28th, 2019. And the date that the dentist signed the form is July 30th, 2019. It's really important you don't enter those 2 dates as the event date of the most recent dental exam. Doing that will throw off our tracking of dental records because children need to be attending their dentist every 6 months starting at age 1. And what I've been seeing is a lot of kids recently have not seen a dentist at all when they come to see us. So it's really, really important that we educate our families on these dental requirements. So I also want to talk about our physical exam form. So in Child Plus, when we are entering the different statuses for blood pressure, growth assessment, hearing, vision, you want to make sure that the BMIs are matching up with what is on the physical exam. So for example, on this physical exam, it says their height was 35 inches and their weight was 24.2 pounds. So in Child Plus, in the growth assessment, you will enter those numbers in the appropriate boxes, and below it, it will calculate a BMI. So in Child Plus, it might say the BMI is 14 for this child. But on this physical form, the doctor wrote it as 13.89. So you just want to verify that you have entered them correctly. Sometimes doctors are putting the height in centimeters, the weight in kilograms instead of pounds. So we just want to be very sure that we double check what is being entered in Child Plus. But generally, BMIs will range between 13 and 25. So if you notice that the BMI is maybe 100, that is a red flag that something's been entered wrong. So our physical exams, when entered in Child Plus, we need to make sure we are entering the correct statuses for the events. So in this picture, these two things cannot exist together. The event cannot be completed, but be attempted but unable to obtain. In the drop down of that box, there's an option to choose unable to test. That is what you would pick if a physical exam notes that they were unable to test a child's hearing or vision. But just remember, these cannot be the same. These cannot be both of these statuses. So for eyes and ears, we just need to remember the difference between functionally and appearance. So for children in this age group of between 3 to 5 years old, they should be having their vision and hearing tested when they turn 3. Unfortunately, some doctors are not completing these due to the child's age. So on these physical exams, on the left, if it says the vision was normal, you would enter that as completed and the results were normal. For hearing, it has an NA, not applicable. So that means they did not complete the hearing exam. But on the right, this kind of physical exam just says that their eyes and ears were normal. That means they did not do the hearing and vision test. When you go to a doctor's office, they may just look in your eyes with the light, have you follow the light. That is what they're doing on this right-hand physical. They did not do the actual screening test. So when entering that in Child Plus, you would enter that as not completed. I know it says their eyes and ears were normal, but that means they only looked normal. They did not test if they were functioning normally. And what we need is the test of functionally, not appearance. And if this form states that it's been subjective until age 3 or 4 and nothing has been entered, just remember the status in Child Plus would be not completed. This physical exam form, we need to remember this does not count as the documentation of a physical exam. And there's a few reasons why. First of all, there's not a date on here for when the exam was completed. There's a date at the bottom right-hand corner of when the doctor signed the form, which we could assume is the date of the physical exam that it was completed, but we're not positive. So we don't want to enter this form as a physical exam. The other reason is it does not have a blood pressure listed on it. It does not have a growth assessment listed on it. And on this one specifically, they also did not include any vision test results, any hearing test results, or lead test results. So for us, this form doesn't tell us anything that we need. So we really need to work with families if this is the form that we're receiving, that they can provide us with a different physical exam form with that information. We really, really need the blood pressure and the growth assessment results at the bare minimum. If they have forms that have the vision and hearing results on it, that's even better. So like I was mentioning before, sometimes doctors are entering on physical exam forms different measurements for growth assessments usually. So we need to remember when converting measurements, there's 12 inches in a foot. So if someone notes a child's height as 3 feet 2 inches, we need to remember 12 inches in a foot, 3 times 12 is 36 inches, plus those other 2 inches, that would make their height 38 inches. We also need to remember about changing kilograms to pounds or centimeters to inches, which I will be honest with you, I don't know off the top of my head. I always do a quick Google search to convert these. And then we also just need to remember the differences between fractions to decimals with height. So if a doctor notes on a form that a child was 30¼ inches, we just need to remember that a quarter is 0.25. So we would enter in Child Plus 30.25 inches. With weight, unfortunately, Child Plus only allows us to enter decimals for height, but not weight. So if a child's physical form notes their weight as 30 pounds and 6.8 ounces, in Child Plus, you can't enter 6.8 ounces. You need to round up. So if it's over 0.5, so if it was 6.5 ounces, you would round up to 7. If it was 6.4 ounces, you want to round down to 6 ounces. And that's what you would enter in Child Plus. So in this instance, 6.8 ounces, round up, enter that as 7 ounces. And then we just want to remember, are all of this child's health events entered in Child Plus? So for a physical exam, we need a blood pressure, a growth assessment, and hopefully a hearing and vision test. We also need a dental exam and lead and hemoglobin tests, which I will talk about more later on why those are so important. Even if no results are reported or if it's left blank on their physical exam form, we still need to enter the event in Child Plus, but make sure you're entering the status as not completed. And I also just want to give a quick reminder that FEWs are not required to enter events for toilet training, food security, IHPs, or dietary preferences or needs. Those are all my responsibility. But I just ask that you communicate with me if a child suddenly needs an IHP, just please let me know so I can enter everything correctly in Child Plus. We also need to remember that physical exams and sick visits are not the same thing. So physical exams are normally called a well child check, a well child visit, an annual exam. Normally insurance will only allow for 1 exam per year once they turn 3 years old. Prior to turning 3 years old, children go to the doctor much more frequently. And for children 3 years and older, a physical should include what we talked about earlier, height and weight, blood pressure, and a full body assessment, which is normally they'll look in their ears, their eyes, their nose, their mouth, their abdomen, and they'll hopefully do their vision and hearing tests. So on the other hand, sick visits, emergency room visits, follow-up visits, specialist visits, this is normally when a child goes to a doctor with a chief complaint. So for example, maybe a child goes to the emergency room because their ankle hurts. They tripped and fell and their ankle hurts. At an emergency room visit or a sick visit, they'll most likely have the child's weight checked, but they're not going to have their blood pressure checked or their height checked because that isn't their main concern. So when parents provide these kind of records to us, we don't need to enter these into Child Plus. If you enter a sick visit date as a physical exam, it's going to throw off our tracking of physical exams. So again, we need to educate families on what kind of records we accept, and we need to be more diligent on reading what the forms say, and seeing if it says a chief complaint, then that's not the record we need. So, expired health records and lab results. So one of our processes is at the beginning of every month, I'm going to run report 3035, which will tell me which children's physical and dental exams are expired or will be expiring. And I will send them to each FEW by site. Then I will need you to reach out to families and make sure they understand that children are required to have a physical exam once a year and a dental exam every 6 months. Just because a parent turned in a physical exam to us in September does not mean that it's an up-to-date physical. That physical exam could have been dated in 2020. So just because a parent might say to you, but I gave you these records at the beginning of the year, but we need to look at the dates and make sure that it's an up-to-date physical exam. With lead and hemoglobin testing, something that's really, really important is that we are educating families on the requirements for lead and hemoglobin testing in Pennsylvania, because a majority of our children are on Medicaid or medical assistance insurance, and children on these insurances are required to be tested for lead poisoning at ages 12 months and 24 months. And the reason why is because lead poisoning and anemia can have severe effects on a child's physical, mental, and behavioral health. Their bodies are not made, they're too small to process the lead in their blood if it's an exorbitant amount of lead. So it's important that we educate our families on this requirement, and we need to obtain the lead and hemoglobin results. If the results are abnormal, we need to provide resources for the family and help them with connecting with their doctors so their children can be retested and develop a treatment plan and lower their child's lead levels. Without a completed lead test in Child Plus, our children are not considered up to date on their health requirements, which means even if a child's physical exam is still current, if we don't have record of a lead test, it means that their physical exam is not going to be counted on our data reporting. So it's really, really vital that we are communicating with our families and educating them on this requirement, because it's really something that their doctors should be doing, and it's important for their child's health. When we are requesting medical or dental records, this is a bit of a new system that we've created. So there are many ways that parents can submit their health records to us. They can bring the physical paper copy to their teacher or to their FEW. They can email a picture or a PDF of it to the FEW or myself. They can have the doctor fax it directly to us, or they can text a picture of it to the FEW, their teacher, or myself. Our new process for requesting records is going to be that we first speak with the parents and ask them to provide updated records. If, a couple weeks go by and we followed up with the parents already and reminded them a second time that we need these updated records, but it seems like they're struggling to get to the doctor's office to get the form, or they haven't responded to your emails, your phone calls, your text messages, what we can do is send a fax request to their doctor or dentist office to request these records ourselves. But this means we need to have a signed consent form on file for them, for their child, and that consent form needs to be included in the fax request. So something new we are going to implement is at all of the enrollment meetings, in the enrollment packets now include a consent form. The parents need to sign the consent form. They don't have to if they don't want to, but it will definitely expedite this process because it is a requirement for us to have these records. So I'm hoping that this will help support our efforts to have the records up to date. So all parents should have a signed consent form completed during their enrollment meeting with yourself. But even if we have the signed consent form and we're going to send a fax to the doctor or dentist, we still need to notify the parents that we are sending a fax to their doctor. It's important that the parents are involved in the entire process and that we're communicating with them. So this is recently a form that I found on SharePoint. I don't believe we used it at all last year. I had honestly never seen it before, but I feel like it could be very useful for us because we can write the exact dates on the form of when these records were due to us. So we can definitely talk about this more later on how we want to go about using this, but I just wanted to show it to you, and hopefully we will use this in the future. So our health screenings also are very important. And there's also different requirements that go along with them, as we talked about earlier with the 45-day point. So if a child needs any health screenings, I will notify you guys with the letters to send home to parents at least 2 weeks in advance of when I will be screening them. So within those 2 weeks, if a parent lets us know that they have an appointment date coming up, or they turn in an updated physical form that has all of the information we need, that means all 4 points, the blood pressure, the growth assessment, the hearing, and vision. If their physical form has all 4 of those, then I don't need to screen them. But if they're missing even one of those, then I still have to screen them for that one topic. So if the parent gives you an upcoming appointment date, in Child Plus, you should go in, create a new physical event, and enter the upcoming date in the scheduled date box. Then, later when the parent gives you the actual physical form, use that same event you created, but don't change the date from the scheduled box to the event date. You need to enter the information as it's been given you, or change the date from the scheduled box to the event date. You don't want to create a new Child Plus event. You want to leave that scheduled date in the scheduled box, and then put that same date in the event date box, and then fill out the information for their blood pressure, their growth assessment, their hearing, and their vision tests. So just remember, screenings that I complete are not considered a physical exam. I'm not a healthcare professional. I do not have a medical license. I am not qualified to do physical exams. I am only qualified to do these screenings because anyone can really be trained on doing these screenings. But I have had parents last year who would say, after we requested a new physical exam form from them, that they told me that they were told that a physical exam was being completed in school for them. And I had to inform them that no, that was me who did those, but it was not a physical exam. It was screenings. So screenings are not a physical exam, and parents still need to schedule an appointment with their doctor if their child is due. Even if I do the screenings, if a child's physical exam is expiring 2 months later, they still need to go to the doctor and get a new physical exam completed. This is our health screening letter. This is what I will fill out with the required information. And then I will send to you guys to send to the families to notify them. I also normally will send a message out on Learning Genie to the appropriate families, just as another reminder. And then the parents can get back to us with any information that they may have. So, our completed screening forms. Step 1, the results when I complete the screenings will be on the screening form, and then I will enter the results in Child Plus. I will scan the form into a PDF and upload it in the attachments. Then I will bring you the physical form, and I will put it on your desk or hand it to you. In some way, you will get this form with the results. Step 3, you will give the form to the parent. You need to go over the form with them, make sure that they understand the results that are on there, and if they need to go for a follow-up test with their doctor. Parents must follow up with their child's doctor if they fail the vision or hearing screening. It's really important. We've had children who have failed and then needed glasses because they failed the vision test, or realized that they have a hearing problem because they failed the hearing exam. So it's really, really important that they follow up with their child's doctor. After they follow up with their doctor, on the back of the form is what the doctor should fill out with the follow-up test results. We need that back to us. So we need to retrieve this form from the parent after the follow-up is completed. And then last step, we're going to upload this result to Child Plus. And then when you upload the file to Child Plus, you need to flag it with the yellow folder. This will make sure that I can find these updated results. I check the yellow folder results, the yellow folder flag about once a week. So you are not required to enter the follow-up results as an event. Just upload the file in the attachments, and then I will go through and enter the results in the events. I'm hoping that makes sense. So IHPs, I know everyone loves IHPs. First of all, our best practice is to update our IHPs at the beginning of the school year for any returning students. We have been working really hard on doing that this summer. Any child with a medical condition or a dietary restriction cannot attend school without the completed IHP, and they need to have their medication in the prescription labeled box. So this, we cannot accept inhalers in a Ziploc bag with the child's name written on it in Sharpie. That is not okay. We cannot accept that. Parents need to know that it needs to be in the prescription labeled box. It should have the child's name, their birthday, the dosage information. This is because when a parent brings in an inhaler in a Ziploc bag, that could really be anyone's medication. How are we supposed to know that that's actually this child's medication with the correct dosage? So we need to make sure that they are bringing the required information to school on the first day of school. If they don't have it on the first day, unfortunately, they're going to have to go home, because we need to make sure that we are doing everything correctly in order to support our children's health. And it's a liability if a child is in school without required medication, because if they have an asthma attack or something similar like that, we don't have the medication, it's going to be a very, very bad problem. So also, if a parent says that their child no longer has this diagnosis or doesn't need the medication, unfortunately, we cannot take only the parent's word for it. We need it in writing from the doctor stating that this is true, that the child no longer has asthma, no longer needs the medication, and then we need to upload this note to Child Plus. If a child has multiple diagnoses, so for example, if a child has asthma and is allergic to peanuts, we need the parent to have the doctor include all of these diagnoses on one IHP. We also, with our doctor's documentation versus an IHP, if a doctor sends in the medical instructions on their own letterhead instead of on our IHP form, that's okay. We just need to make sure that the doctor signed that form, and that the parent signs either directly on the doctor's note or on the IHP. It's really, really important. We need to have the doctor's signature and the parent's signature. If we get the doctor's note on their own letterhead instead of the IHP, I will type the information onto our IHP with the doctor's note attached to it, and then sign it. Remember, an IHP is not complete if it does not have the doctor's signature, the parent's signature, and my signature. So when do we need an IHP? I know this has been confusing for some people, and sometimes it's still confusing for me, because sometimes children will present with conditions that we've never worked with before. So generally, we need an IHP for severe chronic conditions or dietary needs. So this is normally asthma, seizures, any kind of food allergy or an allergy that requires an EpiPen. If the child needs Pediasure, we need that noted on an IHP. If a child has diabetes, any milk that a child, parent wants their child to have that is not dairy, lactate, or soy. If a parent wants their child to have almond milk, it needs to be written by a doctor. We cannot have almond milk as a preference. We also need an IHP for G6PD, because sometimes these children with this immunodeficiency cannot have fava beans. If a child has GERD, we may need an IHP depending on if they can't have certain foods, like normally they can't have acidic foods. And we also need an IHP for any kind of medication that needs to be given more than 3 times per day. If a child needs a medication that's given 2 times a day, we generally don't need that medication in school because the parent can give it in the morning before coming to school and in the afternoon when they come home from school. And we also generally don't need IHPs for any seasonal allergies. Medication allergies such as amoxicillin, because amoxicillin is a prescription medication. So we would not be giving this kind of medication at school because we don't have access to that medication. We also don't need an IHP necessarily for autism or other developmental delays unless it's connected to a food texture sensitivity. We don't need IHPs for lactose intolerance. And we don't need IHPs for dietary preferences, like no pork, vegetarian, things like that. But I don't expect you to remember all of this information. I just want you to know a general idea. And if you ever are concerned, if you don't know if we need one, please always reach out to me. And I will let you know if we need one. Sometimes the situation can be tricky. It might seem like we don't, but then we'll end up needing an IHP. So I always suggest, please, please, please reach out to me as soon as you know something, as soon as you have a question, and I can let you know how to move forward. So that is the end of this training. Again, I'm sorry I'm not there with you in person to address any of your questions. But as always, I'm available whenever, if you have any questions, any concerns, you can always email me. I'm always available by email, phone, come find me in person. But I hope that you learned something from this training, and I hope that we have a great start to the school year. So thank you guys so much, and I will see you soon.